Hello, it's me again. My previous video, unfortunately, whoops, let's try and get this right. Unfortunately, YouTube cut off the video about 5 minutes before it was going to end. So, at the end of my last video, I was talking about the King Report, published in 2000. Now, that's a very interesting report. It was instigated by the government. Professor King looked at 3 treatments for depression. He looked at regular visits to the doctor's surgery as part of a planned treatment program, so it wasn't a random study in terms of doing nothing. He also looked at the effectiveness of cognitive behaviour therapy and person-centred or non-directive person-centred counselling. Now, the interesting thing about the results of this study, and this again confirms what Professor King was talking about earlier, the interesting results was that the therapeutic outcomes, in other words, how well did people feel at the end of the therapy, were all broadly similar. Regular visits to the doctor's surgery was slightly less effective than either CBT or person-centred. There was another criterion Professor King looked at, and that was how rewarding or how satisfactory an experience was being in therapy. And that again was interesting because it wasn't perhaps quite what the government who supports CBT actually anticipated. What it came out as the person-centred, the people who experienced person-centred had a much higher satisfaction rating with the process. And of course, person-centred is very much based on unconditional positive regard for the client. It's based on real empathy and a real attempt to understand the client from their own perspective. And it's also to do with congruence and genuineness. And this therapy had higher satisfaction ratings than cognitive behaviour therapy. Now, it's quite interesting, given that all of the therapies came out as equal, the question surfaces, and again Professor Cooper talked about this, what makes any therapy effective? And again, if you look at the things that CBT and person-centred have in common, they are the therapeutic alliance, and they are client engagement, and they're also perhaps something else. It's about the fact that clients will use therapy in their own particular way to try and get better. If you look at the differences between person-centred and CBT, well, one of the stark differences is that CBT concentrates on distorted thinking patterns and core beliefs, and CBT provides an awful lot of homework for people to do. Now, the question immediately surfaces is why, if distorted thinking patterns and core beliefs are so important, did person-centred, which doesn't actually challenge those things, actually a different approach, why did it come out as equally good? And the question, it certainly supports Professor Cooper in his statement that maybe it's the common elements that CBT shares with other therapies that are effective, rather than the unique features of CBT. And there's an interesting study, I think it's called Castanet study, looked at the unique and the different features of CBT, and that came out with a very interesting finding, that where the therapist concentrated on so-called distorted thinking patterns at the expense of the therapeutic alliance and relationship, far from actually having people healed, it actually had a detrimental effect on the outcomes for clients. So I certainly think that what we need is not the government's monoculture, but we need a rainbow approach where people get choice. I just wanted also to briefly comment in a general way on the experiences I've had in my own practice. Now, I've had people who have come to me with experiences of depression, experiences of panic attacks, etc., and various other things. and some of these clients have been through CBT. And after having some sessions of my own sort of focusing and experiential psychotherapy, the comments that I've now got from several clients is this, that CBT basically patched them up. CBT gave quick fix solutions, it gave them techniques to dispute, to argue with their feelings, to even suppress their feelings, suppress their panic attacks. But when they actually done the focusing and experiential, what they found is that depression begins to lift, not just on a temporary basis, but it feels deeper. The panic attacks are not suppressed, but they actually go altogether. Now, it's quite interesting that these very people who have been, if you like, patched up with CBT, on the tick boxes would have been classified as successful CBT clients. They would be the proof that CBT works. And yet the fact that they're coming to me and that they're finding, in terms of experiential therapy, something that actually goes deeper, is quite interesting as sort of anecdotal evidence. Now, it may be that the sort of therapy I do, they just wouldn't have been able to cope with it at the time that they had the CBT, but that's speculation. It does seem that CBT, if you like, doesn't have long-term results, and even the mindfulness-based cognitive therapy, which I'm also a great fan of, was actually produced because there seemed to be a very high incidence of relapse from depression once the CBT therapy had stopped. And again, perhaps part of the problem is that the concentration on distorted thinking and core beliefs really doesn't actually get to the root of the issues. That in fact we often think negative thoughts, not because we have distorted core beliefs, but because we have depressed feelings. That the depressive feelings come first, and the thinking patterns are like a response to it. I'd also like to share on a very personal level my own journey out of depression. And what I found, I had humanistic counselling for that, what I found was that as I began to process the feelings in a sense were not caused by my negative thinking, but they actually fueled my negative thinking. And once the feelings had been processed, the negative thinking just began to drop off. Like autumn leaves, when the sap stops going into the leaves, they drop off. And it's the primacy of experience rather than cognition that was certainly effective in my own journey out of depression. So I'm hoping that this is food for thought, and I'm hoping YouTube don't cut off this video in the way that they cut off my previous video. Many thanks. Bye.